Welcome to LUMP Lecture Series featuring the 5 SHU points, Part 12, the 5 transport pairs. This is presented by LUMP AccuWellness Foundation, Inc. In general, there are 3 ways that the 5 transport points are paired: strengthening the mother or draining the child, open point treatment, and treatment based on transport point physiology. This is a traditional application of the 5 transport points: strengthening the mother or draining the child. In this approach, points are chosen based on their 5-phase associations. One common method is to choose the point associated with the mother or child phase of the channel on which it is found. The mother phase is the one before the affected phase in the generative cycle, while the child phase follows the affected phase. Mother points tonify, while child points drain. For example, one might choose spleen 2, the far point on an earth channel, to tonify the spleen, and spleen 5, the metal point on the earth channel, to drain spleen excess. Another approach is to choose 5 phase points on one channel to treat a different channel. Continuing with the example of the spleen, one would choose heart 8, the far point on the far channel, mother of earth, in cases of spleen deficiency, and lung 8, the metal point on the metal channel, the child of the earth, in cases of excess. This approach is generally familiar to most students of Chinese medicine. Modern 5-element acupuncture traditions also explore in greater detail the complexities of the 5-phase associations and the use of the controlling cycle points as well. In Method 1, the mother fire point is tonified, while the sun metal point is sedated. In cases of spleen deficiency, choose spleen 2, and in cases of excess, spleen 5. In Method 2, tonifying the spleen involves choosing the mother point on the mother channel, heart 8. This is often combined with the point on the affected channel that is associated with the channel's element, spleen 3 in this case. To sedate the spleen, one would choose the sun point from the sun channel, lung 8. This might be combined with the sun point, metal, on the spleen channel, spleen 5. The second approach to using the 5 transport points involves chronoacupuncture and similar traditions that emphasize certain open points based on the circulation of qi in the channels throughout the day. This approach involves considerations of classical Chinese astrology, XING studies, and Taoist traditions. These systems have been used extensively both in the past and in the modern era. The idea that there is more qi and blood in a particular channel at a particular time of day is one that deserves further research. The third approach involves considerations of qi development in the channels and the nature of qi movement through the 5 transport points as conceived in the physiological model of the classic ofDifficulties. This is the model described in this episode. The functions of the points are considered in the context of overall channel qi development, from the roots in the fingers and toes to junctions in the organs of the trunk. In reality, the use of point pairs in the clinic often involves both the first and third approaches, sometimes at the same time. This is mostly because the nature of the points suggested by their 5-phase associations is often in tandem with the development of channel qi as envisaged by the classic ofDifficulties. However, because the nature and functions of the organs differ, the ability of their 5 transport points to clear heat, transform dampness, move qi, tonify or drain also differs slightly from channel to channel. In the end, the ultimate determinant of which points to use is the impartial standard of clinical efficacy. If the treatment works, then it will be used. Fortunately, the model outlined by 5-transport point theory and to some degree the indications of 5-phase theory help to give structure to the process of point selection. A survey of classical texts as well as the acupuncture point codes memorized by students of Chinese medicine over the millennia reveals that the majority of classical acupuncture prescriptions incorporate the 5 transport or source points of the 12 channels. Similarly, in the modern clinic, most acupuncture treatments involve at least one of these important points. A helpful way to conceptualize their use in the clinic is to combine the points into functional pairs. The combination of the stream or source and C points on the spleen tie-in channel has the ability to warm the yang and benefit the spleen qi to transform dampness. In the clinic, the pair is effective in cases of abdominal swelling caused by qi deficiency. It is less effective in cases where swelling is of an excess water dampness accumulation type. Qi deficiency can lead to diffuse swelling that feels soft to the touch and gives way easily to pressure. On the other hand, the accumulation of water dampness causes the abdomen to feel hard when pressed, indicating substantial buildup of fluids. Diarrhea and/or abdominal distension due to spleen deficiency are also often treated with this point pair, spleen 3 and spleen 9. In analyzing the pair, remember that the classic of difficulties says that the stream point is used to treat heaviness in the body, while the C point acts to regulate the qi transformation of the spleen. As the source point, spleen 3 also guides the source qi into the channel to strengthen spleen function. The net result is to effectively benefit and regulate the spleen qi with the specific goal of transforming dampness caused by deficiency. This point pair can also be used for swelling related to spleen qi deficiency in other areas of the body and in cases of leg swelling during menstruation as well. Sometimes the pair is combined with other similar pairs for greater emphasis. For example, with stomach 36 and conception vessel 12 to further benefit the qi of the middle burner. Lung 11 and lung 5. This pair is used clinically to clear heat and benefit the throat. It is indicated not only for the common sore throat, but also for tonsillitis and laryngitis. The pair can also nourish the yin and stop coughing. Patients who present with loss of voice secondary to external invasion are often treated at these points when the primary pathogen is heat. In such cases, lung 11 is usually needled shallowly and gently twirled for a moment after insertion to disperse the area. By contrast, the technique at lung 5 generally involves more lifting and thrusting of the needle. This is a well C point pair. Heat is cleared by shaking the channel out with the well point, while the C point facilitates strong movement. The net effect is to clear and open both the organ and its divergent channel through the throat. The ability of the pair to benefit the yin is a secondary effect of clearing the heat by moving the channel qi. It is the heat that damages the yin. This pair should be contrasted with the pair lung 8 and spleen 2, described in the River Point episode. In the lung 5 and large intestine 11 pair, the case is more strictly one of excess and heat and rarely involves deficiency. The apparent indeficiency in the throat is actually just a side effect of excess heat in the internal pathway of the lung channel. Thus, while the pair lung 5 and lung 11 benefits the throat by clearing heat, the pair lung 8 and spleen 2 releases the exterior by virtue of its ability to move and also protect the in. Consequently, in the clinic, lung 5 and lung 11 are most often used in treating acute excess cases where the dominant symptom is sore throat. The lung 8 and spleen 2 pair is used in more lingering cases of external invasion where deficiency is also present. Triple burner 6 and gallbladder 34. This pair combines a river point with a sea point, both on SHAO-YANG channels. Both points can strongly move the qi. Together, the pair is used in the clinic to strongly dredge and drain the SHAO-YANG. Because yang channels are often used to clear excess in their paired yin channels, these points can also clear excess from the Ju-yin. Clinical manifestations of this pathodynamic are varied and may include abdominal distension, premenstrual syndrome, dysmenorrhea, constipation, hypochondriac pain, or inflammation of the gallbladder. Most importantly, the underlying cause should be stasis in the SHAO-YANG or Ju-yin. The functions of this pair are compared and contrasted with a similar SHAO-YANG pair, triple burner 5 and gallbladder 41. The first two pairs discussed earlier were of transport points on the same channel, while the third pair involved two same name channels. In this fourth pair, there are transport points from internally-externally paired channels. The C point on the yang channel regulates movement, while the stream or source point on the yin channel tonifies. Together, they move the yang qi. In this case, because of the addition of a yang channel point, the spleen yang is stimulated, which strengthens the middle. Like the pair spleen 3 and spleen 9 introduced a while ago, this pair is used to strengthen the spleen. However, while the stomach 36 and spleen 3 pair has a stronger ability to tonify the spleen, the former pair acts more upon dampness. This pair is therefore used in chronic cases with more serious deficiency that is likely to involve the yang. The pathodynamic may lead to such medical diagnosis as chronic colitis, chronic gastritis, some types of anemia, or Crohn's disease. Kidney 7 and liver 2. This is a variation on the theme of mother-child treatment. In this case, the metal or river point of the water channel, the mother point, is combined with the fire spring point on the wood channel, child point, with the net effect of benefiting water and calming wood. Here, one is tonifying the mother and draining the child at the same time. Also reminiscent of the pair lung 8 and spleen 2 described earlier, the moving heat-clearing actions of a river point are combined with the ability of the spring point to calm heat from deficiency. This case is different, however, because instead of combining 2 points on channels of the same name, tie-in, this pair combines points on mother-child 5-phase channels. The net effect is different. With this pair, tonification is combined with draining in a mother-child channel pair. The underlying pathodynamic indicated for this pair is kidney deficiency that leads to liver yang rising. Symptoms may include dizziness, irritability, ear ringing, high blood pressure, or Meniere's disease. Note that this pair involves the combination of 5-phase concepts with the classic of difficulties 5 transport point theory. The same logic regarding the use of river and spring points that was used in conceiving the lung 8 and spleen 2 point pair is combined with a consideration of 5-phase channel relationships. This is the kind of integrative thinking which, when combined with an understanding of organ theory, leads to innovation and flexibility in the clinic. The lung 8 and spleen 2 point pair is best understood by considering the different types of chi flow at spring and river points. In this case, 5-phase theory is less helpful for conceptualizing function. Thank you very much for your attention and see you on our next videos.